Hello, this is Moises with Cura for Care in Nashville, Tennessee. The medical system is changing and it's bringing a lot of confusion to seniors and those living with memory loss. We thought we would post this video along with a host of others to help individuals and families cope with changing systems and changing capacity in their lives. Today we'd like to talk about discharge planning with hospitals. It used to be that you could get a referral to the hospital from your doctor. Your doctor would accompany you to the hospital. They would check up on you. They would make plans. They would talk to the hospital staff, and they would get a discharge plan for you, guide you through rehab, take you home, and you'd be all under the care of a doctor. Well, that doesn't happen anymore. What happens today is your doctor will refer you to 911, where you'll go to the emergency room or be admitted to the hospital. The doctor at the hospital, called the hospitalist, will take over your case, do all the analysis, make some recommendations, and when they're ready to discharge you, they'll discharge you to a rehab center. The rehab center will then do their own assessment, figure out what needs to be done for you, and when you're ready to go home, they will discharge you with their set of plans. Well, what happens is that many people, when they get home, end up with a mess. Last week, we had a gentleman come home, and his wife called us up and said, Moises, we got discharged from the hospital, I'm home, and I can't get John out of the car. Needless to say, we got in our car, we rushed down there, we helped John get out of the home, into the house, and we discovered that the discharge plan did not include his medications, did not include any kind of walker or facilities or special equipment that he may need at home. The discharge plan had not been coordinated with his doctor, and now he's sitting at home saying, what medicines am I supposed to take? Well, at Cura, we provide that service to help people get quality discharge plans at home, coordinating all of those factors. What we did with this gentleman was that we called the hospital, called the rehab center, called his doctor, called his pharmacy, managed to get some updated medication list. When we tried to get the medical equipment, the rehab center said they couldn't do it because he was already discharged and they could not make that referral. When we called the doctor said he hadn't examined him, so he could not make the referral for any special medical equipment. Catch-22. We persuaded the rehab center and the doctor to speak, and together they were able to come up with a plan. And that day, we were able to provide him with a wheelchair and a walker and a bedside commode, and also made arrangements for a hospital bed, which we decided not to use. Anyway, those challenges were quite significant, and we were there to help him. Ideally, what you want to do is have an advocate working for you that can arrange these kinds of things before you go. In our case, it would be Cura for Care, or it would be your family member. What they would do is, before you get discharged, a day or two before, they would coordinate plans with the rehab or hospital, make arrangements for any kind of special equipment you need, make arrangements to get you home, evaluate how transportation is going to happen, and make sure that that plan is well executed and that you have everything that you need. Another thing you may want to consider is who pays for all this. Well, if you get those kinds of referrals and items taken care of before you leave the hospital or the rehab center, Medicare or your insurance provider will pay for those items. If you go home without the referral, what's going to happen is they're going to say, well, we can't refer you for that. You need a doctor's order, so you need to go then see your doctor and have that prescribed for you, or you'll be paying for it out of pocket. So at Cura for Care, we're trying to smooth that transition. So it's a good idea to plan ahead. We have individuals who register with us and just know that if they need assistance, they can call us. We'll jump to it. Be there when they get admitted to the hospital, be there when they get discharged from the hospital, and make sure that they get everything they need and that their benefits are covered exactly how they need. Anyway, my name is Moises Paz. I'm with Cura for Care. I hope you find this video helpful, and if you'd like, you can give us a call anytime. There's no cost for a consultation. We also provide free in-home consultations, and we're happy to talk with you or your children or your families, or give some tips to your advocate to make sure that you're well taken care of when you go in, and more importantly, when you come out and start living at home. My name is Moises Paz. I'm with Cura for Care in Nashville, Tennessee. Thank you very much.